We've all noticed that there seems to be more tragic stories every day of young people, especially young men, dropping dead. And now the FDA is warning of a catastrophic drop in U.S. life expectancy. In the first 9 months of this year, 158,000 more Americans died unexpectedly than in all of 2019. Now, just to give you some perspective, that's more than the casualties in every war since Vietnam, all of them combined. Now, actuarial reports that young people are being disproportionately affected here. Mortality was 26% higher among insured 35 to 44-year-olds and 19% higher for 25 to 34-year-olds. This is overall COVID deaths, of course, have dropped 84% since 2021. And my next guest is sounding the alarm. President and Chief Medical Officer of the Frontline COVID-19 Critical Care Alliance, Dr. Pierre Kory. Dr. Kory, we got to know each other during COVID. These figures are staggering. Now, I think people see these numbers, Dr. Kory, and they might blame fentanyl or drugs or unknown heart problems, even in young athletes. People say that they're not uncommon. It's happened in years prior. So could this explain all these deaths?
No, absolutely not. I mean, if you take a close look at the numbers, and the life insurance industry, the actuaries have done this. It's the timing. Fentanyl didn't just explode on the scene in 2021. Global warming or obesity or diabetes or deaths of despair. I mean, the timing is really inarguable. I mean, we have to answer the question, why are the healthiest elements of society, these are young, employed folks with life insurance, suddenly started dying at rates we've never seen before in 2021, and it continues. And so we're left with the question, what happened in the American workplace in 2021 that led to this unprecedented rate of death? And the challenge here, Laura, is we're trying to ask the question. We wrote that op-ed trying to put that data out there. We need our government to function. Public health, one of their main objectives or responsibilities is to collect this data to inform us so that we can, enact policies. And I don't see an organized effort to trying to answer the question why young people are dying so much.
Well, and Doctor, Journal of American Medical Association study on cancer diagnoses between 2010 and 2019 found that certain kinds of cancer were being diagnosed more often in younger adults in the United States, and increases seem to be driven by cancers in women and adults in their 30s. So overall, early onset cancers increased over that decade by an average of 0.28% each year. And among women, it was like 0.67%. So that's 33% and 7% respectively over that time frame. So have you seen that kind of uptick firsthand?
Well, the numbers that you just quoted are dwarfed by what we're describing. I mean, we're seeing these rises, these sudden rises in traditionally healthy sectors of society. We've never seen dying at this rate. I mean, unless we send all our young people to war, you can't explain why so many young people are dying. And